Okay, so let's talk about fever-reducing medications, fevers in kiddos. First and foremost, we need to define what a fever is. A fever is 100.4 degrees Fahrenheit or 38 degrees Celsius or higher. A temperature of 99.9 is not a fever. Fevers are not inherently bad things. They are the body's mechanism for fighting off germs. However, fevers can make kids feel really, really unwell to the point they will not eat and drink. And also very, very high fevers can lead to seizures. So we want to make sure we do control them. But we don't need to be taking a temperature every 10.5 seconds to make sure the second the fever becomes a true fever that we give a medication. So let's start with our littlest ones from 0 to 3 months. So 0 to 90 days old. If your child has a fever, please take your child to the emergency department. Again, the fever is 100.4 Fahrenheit, 38 degrees Celsius. 0 to 90 days, if that child gets a fever, take them to a hospital. Ideally to a children's hospital, or at least a hospital with a pediatrics unit. But if that's not available, any emergency department and a transfer can occur if needed. But 0 to 90 days old, if they have a fever, take them straight to the emergency department. Next, from that 90 days to 6 months old, so about 3 to 6 months, if they have a fever, Tylenol is the only medication you can give for a fever. Under 6 months old cannot get ibuprofen. They can only have Tylenol. You can do the Tylenol every 4 to 6 hours based on the package instructions. Now, 6 months old and up can get both ibuprofen and Tylenol. Ibuprofen is also known as Motrin. And you can actually alternate these two medications every 3 hours. So you do like Tylenol at 9, ibuprofen at noon, Tylenol at 3, ibuprofen at 6. So you can alternate them every 3 hours. These medications should truly be weight-based dosing. So you need an accurate weight on your kiddo to give them the right amount. A lot of parents bring their kiddo in saying the Tylenol didn't bring down their fever, and we find out that they aren't giving their kiddos enough Tylenol because they're going by the package instructions based on their age or an old weight or whatever it is. So having an up-to-date weight is super important. Remember, when you're getting an up-to-date weight, you want to make sure your kiddo is naked because we want their true body weight, not the weight of their favorite blankie and their toy and the 9 layers they have on. We want their body weight. So you can give your kiddo medication, again, alternating those every 3 hours to keep the fever down. And the most important thing with keeping their fever down is that they're eating and drinking and willing to kind of participate in their care type of thing. When kiddos have a fever, they tend not to want to eat and drink. They don't want to do anything. They want to lay around. And that's where we start getting into trouble, when they stop kind of eating and drinking being the more important part here. You know, the kiddo could be like a little toddler eating you out of house and home, but the second they get sick, suddenly they don't want to eat. That's a lot of effort to eat is effort. Drinking is not, and the hydration really is more important here. So if they have a fever, having them drink like cool liquids or eating popsicles, that's a great one, because what kiddo doesn't love a popsicle, right? They're fun. So you use popsicles or Jell-O. Those all are liquids. They count as liquids and fill the tank as a liquid, but they're more fun for the kids. You could be like, oh, a popsicle sounds great, or some jiggly Jell-O. Like, that's just more fun than here's a cup of water, drink up. Now, if for any reason you have a concern, you're like, I need to get them in front of a doctor now, please take your child to the emergency department. I will not tell you not to. However, let me manage some expectations when you do take your child to the hospital. First and foremost is please know what the temperature was. You say they have a fever, I want a number. Tell me what a temperature is, because again, especially if it's a real little, like that under 3-month-old one, if you tell me they had a fever, I need to know the number. I need to know what it is, because if it's not 100.4 or higher, we're not gonna, go into the whole fever protocol for a little. If it is 100.4 or higher, that child is undergoing blood work, a urinalysis, COVID flu RSV swab, and possibly even a lumbar puncture, because we need to find the source of the infection. So please, when you bring your child in for a fever, tell me what the number is. Make sure you've measured the temperature. The ways to do that are rectally, axillary, which is under your armpit, or orally if they're older. With oral, they cannot have had anything to eat or drink in the last 30 minutes, because obviously if they had something cold, it's going to be colder. If they had something warm, it's going to be warmer. And they need to be able to put it under their tongue and close their mouth. They need to be able to follow the instructions. If they can't do that, it's not going to work. It's also very hard with kiddos who are super congested because they're breathing through their mouth right now. They're going to have it open while they're taking the temperature. It's not going to be accurate. Rectal is pretty much the gold standard. Unfortunately, it's a little bit invasive. It's not fun. Kids yell about it, but that is the gold standard. Next would be if your child truly does have a fever and you're bringing them to the hospital, please give them meds before you come in. It's actually just going to save you money. That's kind of the logic here, is because if your child comes in with a fever and you're like, yeah, I wanted to make sure you saw you had the fever, you know what the first thing I'm going to do is? Give them meds to lower their fever. I don't need you to prove it. If you have the number, if you could tell me it was this and I measured it this way, it was 102.4 and I measured that rectally, then I have the number. Great. And then you say, I gave them a dose of ibuprofen based on their weight. Congratulations. Now you just won the Good Parent Award. Like, phenomenal. I'm here for it. So do that. It saves you money. It saves us time. And it lets us see, because if the kid has a fever, they're not going to be acting themselves. They're not going to be at their baseline. They're not going to want to eat and drink. But if you've treated their fever, they're going to start feeling a little bit better. They'll be more willing to eat and drink, more willing to participate, and will be able to take better care, if that makes sense. Also, if you've been, say, kiddos had a fever, you've been alternating your meds, that type of thing, and it's A, just not breaking, or B, they just don't look right, or C, just something else is bugging you and you're bringing them in, please make sure you know what time you actually gave those last medications. Because I need to know that. Because if they have a fever and they're due for something, I need to know what they're due for so I can order them the right medication so we don't overdose them on one medication or another. So make sure you know about. And it doesn't need to be, I gave this at 2:51. It could be, I gave it about 3 o'clock. That's fine. But make sure you know about what time you gave the medications. And just know that when your kiddo is sick, they're going to want to lay around. They're going to be less energy. They're not going to want to eat. And that's all normal and it's okay. Just give them the hugs and snuggles. Put on Polar Express for the 85th time today and give them juice and Jell-O. They'll be okay.